This question is a scenario question. It's stating that you receive a phone call from a patient who wants to reschedule their upcoming appointment because they have a scheduling conflict, and it's asking what the appropriate choice of action would be for the medical assistant in an administrative role. So option A says to inform the patient that rescheduling is not possible and suggest they try and rearrange their schedule. So that would not be correct. That wouldn't be appropriate to ask the patient to rearrange their schedule to come in. That wouldn't be accommodating to their needs. Option B says to check the provider's schedule and offer the patient an alternative appointment time based on availability. And yeah, that sounds correct. You're giving an alternative, you're allowing the patient to come in on a different time, and you're checking to make sure the provider they need to see will be available at the time you suggest. So option B sounds very good, but let's keep the other options open for now. Option C says to offer the patient the next available appointment, but note here it says without confirming availability with the healthcare provider. So if you don't confirm availability with the provider, they might not actually be available to see the patient, and then they would be coming in when they can't actually be seen. So that would just be frustrating for the patient, and they wouldn't get their appointment in. So we could cross off choice C. And then lastly, option D says to ask the patient to call back later as you are unable to assist with scheduling changes. Well, this unable to assist is not accurate because in this question here, it's stating that you have an administrative role in this office. And an administrative role could include scheduling appointments as you are right here. Additionally, asking the patient to call back later, there really is nothing necessary that would, in this question, that's indicating you would need to speak to the patient at a later time. So we could cross out choice D. And that leaves us with just choice B, which does sound accurate. Check the provider's schedule and offering a patient the alternative date, which solves the problem that they're calling in for. So we will go with choice B here.